Today on PlacidWay Pulse, we're talking about Los Algodones, Mexico, known as Molar City, and what dental tourists should know before crossing the border for implants, crowns, full mouth restoration, all on 4, all on 6, and other dental work.
Yeah, and let me just tell you, it's quite a journey.
Oh, absolutely. And, for many patients, this is not just about dental work. It is about smiling again, eating comfortably, asking the right questions, and feeling confident before traveling for care.
Right, because it's terrifying at first. You're taking your health into your own hands.
You really are. And that's exactly why we're doing this deep dive today. But before we jump into the real nitty-gritty of the travel and the border crossing, I just need to quickly state that this episode is for educational purposes only. It is not medical advice, diagnosis, or a treatment recommendation. Anyone considering dental care abroad should speak with qualified dental or medical professionals, review their personal health history, and ask detailed questions before choosing a provider.
Which is, just common sense. You got to be the CEO of your own healthcare.
Exactly. Nobody cares about your jawbone as much as you do.
Yeah.
So let's rewind a bit. Before you ever stepped foot in Mexico, you were just sitting at home, right? Dealing with this massive problem.
Oh, man. Yeah. I was in so much pain. It was just this constant dull ache that, it dictated my whole life.
Like what you could eat.
What I could eat, how I smiled, usually with my hand over my mouth, And when I finally went to a local specialist, they handed me this quote that looked like a mortgage down payment.
How much are we talking?
Like over $45,000. I literally thought it was a typo.
Oh, my gosh. And I'm guessing your insurance was, totally useless.
Completely. My plan had an annual max of, maybe $1,500.
Which covers what? The x-rays and maybe a cleaning.
Basically, yeah. The other $43,000 was all out of pocket. And I remember just sitting in my car, gripping the steering wheel, thinking, I can't afford to be healthy.
That is just such a dark place to be.
Yeah.
You feel totally helpless.
You really do. And that desperation is what pushes you online. You start searching for, cheaper implants, and this name just keeps popping up.
Molar City.
Yeah. I had heard the name Molar City, but I didn't really know what the day would feel like. I thought it was a scam, honestly.
Right, because we're conditioned to think that if it's cheap, it's got to be dangerous.
Exactly. I was picturing, some rusty tools in a back alley, but then I saw videos of real people just like me coming back with these incredible smiles.
So you start to realize it's a legitimate option, but taking that leap and actually booking the trip, that takes some serious planning. You can't just wing it.
Oh, no. No way. You have to be a project manager for your own mouth.
So when you were finally packing your bags, getting everything together,
Yeah.
What did you bring with you?
I brought my dental records, medication list, and questions because I didn't want to miss anything.
Smart. Very smart. Let's talk about those records first.
Yeah.
Did you just bring physical copies?
Well, I got my local dentist to email me my recent panoramic x-rays, and I forwarded those to the clinic in Mexico before I even left home.
See, that is huge. Getting those baseline x-rays over there early means they can give you a much more accurate preliminary quote.
It saved me so much anxiety, but honestly, the medication list took the most work.
Oh, really? Why is that?
Because they wanted everything, not just prescriptions, but the ibuprofen I was eating, candy, my vitamins, fish oil, everything.
Well, and for the listener, there's a huge medical reason for that. If you're going in for bone surgery, which is what implants are, things like fish oil or aspirin thin your blood.
Right, which means you could bleed out during surgery. The coordinator was super strict about that on the phone.
Yeah, and it's not just blood thinners. If someone takes osteoporosis meds, like bisphosphonates, those literally change how your jawbone heals.
Really? I didn't even know that.
Oh, yeah. If a dentist drills into a jaw altered by those drugs, the bone can actually start dying. You have to lay all your cards on the table.
Wow. Yeah, I even wrote down a mild reaction to an antibiotic I had 10 years ago. Better safe than sorry.
Absolutely. And you mentioned bringing questions, too.
Oh, I had a yellow legal pad just filled with them because I knew once I got there, my adrenaline would be pumping and my brain would just go blank.
Plus having the printed quotes, right?
Yes. I highlighted the exact numbers we agreed on over email. I wasn't going to travel all the way down there and get hit with some surprise fee.
Okay, so you're super prepared. You've got your file, your highlighted quotes.
Yeah.
And then comes the travel part, which is what freaks most people out.
Big time.
Because it's not like flying into a big resort in Cancun. You're driving into the desert. What was going through your mind before you crossed the border?
I remember feeling nervous before I crossed the border. My stomach was just in absolute knots.
I can imagine. The landscape down there near Yuma, Arizona, it's pretty isolated, right?
So isolated, you're driving through this flat desert, and then you turn off toward Andrade, California. It barely even looks like a town.
It's just a road leading to a fence, basically.
Exactly. I kept thinking, did my GPS mess up? Where am I?
But the Andrade crossing is so unique because you don't actually drive into Mexico, do you?
No, and that was the wildest part. You pull up, and there are these huge, secure parking lots run by the local Quechan tribe.
So you just leave your car in California.
Yeah, for like $6 a day. You lock it up, grab your passport and your backpack, and you literally just walk.
Wow. And what is that walk like? Is it chaotic?
Not at all. It's this long, concrete path, and honestly, seeing all these other Americans and Canadians doing the exact same thing really calmed me down.
Oh, I bet. Like a little community of dental tourists.
Yeah. It felt like walking into a football stadium. You go through the turnstiles, maybe flash your passport, and boom, you're in Mexico.
And is the contrast jarring? Like, what do you see right when you step out?
It is instant. You go from empty desert to this vibrant, bustling street. Every single building is a dental clinic, a pharmacy, or a glasses shop.
Just a hyper-concentrated medical hub.
Exactly. And the streets are flat and paved, so there were a lot of people in wheelchairs and walkers getting around easily.
That's amazing. But what about the vibe? Do you get swarmed by salespeople?
There are a few guys handing out flyers. They call them pickers, but they aren't aggressive. You just say, no thanks, and they smile and walk away.
So it actually feels safe.
Incredibly safe. There are tourist police everywhere, and literally everyone speaks perfect English. The whole town is built for us.
That really changes the narrative. So you navigate the streets, you find your clinic, and you walk in. What happened during the consultation?
When I got there, the first thing I wanted was a clear explanation, not pressure. Because back home, you always feel rushed, right?
Oh, totally.
Yeah.
The dentist pops in for 5 minutes, mumbles some jargon, and then the billing person is shoving a loan application in your face.
Exactly. I was terrified of getting that high-pressure sales pitch, but this was the opposite.
Really? How so?
First of all, the clinic was gorgeous. Marble floors, spotless, AC blasting, and they greeted me by name immediately.
Because they already had your x-rays in your file.
Right. And then they took me back to meet the actual dentist. We just sat down eye to eye and went through my legal pad.
You actually pulled out the pad. Good for you.
Oh, yeah. I showed him the highlighted quote. I asked, are there hidden fees? What about anesthesia? And he wasn't offended at all.
That's a great sign. A good doctor wants an engaged patient.
He was super patient. He said, look, this quote is a great estimate based on your 2D x-rays from home, but before we plan surgery, we need our own scans.
Which is the crucial pivot point. That 3D scan. Did the dentist explain the scans and treatment plan clearly?
The scan helped me understand why the dentist was recommending that plan, because he actually showed it to me.
Yes. You're talking about the CBCT scanner, right?
Yeah, that big machine that spins all the way around your head. It felt like something out of a sci-fi movie.
It really is incredible tech. For the listener, standard x-ray is flat. It's just two-dimensional. The dentist can see the height of your bone, but not the thickness.
Right, which is basically guessing.
Exactly. But the CBCT cone beam computed tomography takes hundreds of images and stitches them into a 3D model.
And he pulled that model up on a huge TV screen. He literally spun my skull around with a mouse.
Seeing your own skull like that has to be a trip.
It was terrifying. He pointed to where my teeth were missing and showed me how the bone had basically melted away. He said it was as thin as a potato chip.
Oh, wow. Yeah, when you lose a tooth, your body just stops sending nutrients to that jawbone, so it shrinks.
I could see it with my own eyes. He even showed me this bright red line running through the scan.
The mandibular nerve.
Yes. He said, this is your nerve. We have exactly 3 millimeters of clearance here. That level of detail completely removed the blind trust factor for me.
You were looking at the literal blueprints of your mouth.
Exactly. And once we knew what the bone looked like, we could actually talk about how to fix it. That's when all the heavy dental jargon started flying.
Let's break some of that down because I'm sure they mentioned CAD/CAM in the labs.
Oh, constantly. Back home, getting a crown meant gagging on that awful pink putty.
Oh, the alginate impressions, the absolute worst.
Right. And then you wear a chalky fake tooth for 3 weeks. But here, they use this digital wand.
Yes, the CAD/CAM scanner. It takes thousands of microscopic pictures and builds a perfect 3D model of your mouth instantly. No putty required.
It was so much more comfortable. But the crazy part was what they did with that file.
They send it down the hall to their in-house lab.
Yeah, they don't mail it to another state. They have milling machines right there that carve the crown out of a solid block of porcelain.
It's basically a highly precise robotic sculptor. That's how they can do same-day crowns. The efficiency is just mind-blowing.
It really is. But when we moved from crowns to the actual implants, he had to burst my bubble a bit about the timeline.
Right, because an implant isn't just a quick screw you pop in and walk away with.
I totally thought it was one piece, just a thumbtack, basically.
A lot of people do. But it's actually a three-part system. The first part is the titanium post, which is the artificial root they drill into your jaw.
And that's the part that has to heal for months, right?
Exactly. It's a biological process called osseointegration. See, your body normally attacks foreign objects, but titanium has this microscopic oxide layer.
So it tricks the immune system.
Precisely. Your bone-building cells, the osteoblasts, actually migrate to the titanium and weave living bone right into the threads.
So it literally fuses into your skeleton.
Yes, but it takes 3 to 6 months. If you chew a steak on it too early, it wiggles, fails to heal, and falls out.
Which is why I had to wait for the final teeth.
Right. And once it's healed, they add part 2, the abutment, and part 3, the final milled crown.
But wait, what if your bone is like a potato chip like mine was? You can't drill into that.
Then you need bone grafting. They pack sterilized bone granules into the thin areas, and your body uses it as a scaffold to grow new, thick bone.
He also mentioned a sinus lift, which honestly sounded terrifying.
It sounds medieval, but it's brilliant. Your upper jawbone shrinks, and the sinus cavity drops down. If they drill an implant there, they puncture your sinus.
And cause a massive infection.
Yep. So they gently lift the delicate sinus membrane, like pushing up the bottom of a balloon, and pack bone graft underneath it to create a deep foundation.
It is crazy how much structural engineering goes into your face.
It truly is. Did they end up needing to do all that for you?
Well, this is where my mind was really blown. Because I needed a full mouth restoration, I assumed I'd need like 14 individual posts.
Right, which would be an insane amount of grafting and money.
Exactly. But then he explained the all-on-4 to me.
Ah, the gold standard of Molar City.
Yes. Replacing an entire arch of teeth with just 4 implants. I couldn't understand how 4 screws could handle the pressure of chewing.
Because it seems like it would just snap, right?
Totally. But he showed me on the 3D model, the 2 back implants don't go straight down.
They tilt them.
Yeah, like a sharp 45-degree angle.
It's pure physics. Think of pitching a tent in sand. If you drive the stakes straight down, the wind pulls them right out. But if you angle them deeply into the harder dirt, they hold massive tension.
That is the exact analogy he used. Those angled posts bypass the sinus entirely and anchor into the densest bone. Then they bolt a titanium bar to them.
So it's completely fixed. It doesn't move like a denture.
Right, it's bolted to my skull. But of course I couldn't get the permanent teeth right away.
Because the bone needs to fuse. So what do? Send you home toothless?
No, thankfully. They give you a set of temporary acrylic teeth, but you have to be super careful with them.
Right, they do precise bite adjustments so you don't put uneven pressure on the healing implants.
Exactly. And that surgical trip, it was intense.
Let's talk about the aftermath of that surgery. What surprised you about Molar City when you walked out of the clinic?
Honestly, the empathy. I walked out, my face was swelling up, I'm biting on gauze, and I just felt so vulnerable.
You expect everyone to stare at you?
Yeah, but nobody batted an eye. I walked past the pharmacies, and the pharmacist just gave me a sympathetic nod. There were other people walking around with ice packs strapped to their heads.
It's totally normalized there.
Completely. And then I crossed back over to my hotel in Yuma to recover.
And what was that recovery like? Did they give you a strict protocol?
Oh, incredibly strict. I was propped up on pillows to keep the swelling down, ice packs 20 minutes on, 20 off.
And pain management.
They gave me a super detailed schedule. Painkillers, anti-inflammatories, antibiotics. The golden rule was to stay ahead of the pain.
Don't wait until it hurts to take the pill.
Right. I was setting my phone alarm for 3:00 a.m. just to take a pill.
And what on earth did you eat? With temporary teeth and fresh surgery sites.
Lukewarm mashed potatoes and meal replacement shakes. For weeks.
No chewing allowed at all.
0. Even soft bread is dangerous because tearing it pulls on the implants. If you wiggle them, they fail.
Yep, the micro movements destroy the osseointegration. We also tell people absolutely no smoking.
The dentist terrified me about smoking. He said it constricts the blood vessels, the bone dies, and the implant fails. Period.
And no heavy lifting either to keep your blood pressure down. So you follow the rules, the swelling drops, and it's time to drive home. How did that feel?
Scary. Once I got out of Yuma, the isolation hit me. I kept thinking, what if I get an infection? My doctor is 1,000 miles away.
We lose that safety net.
But the clinic was ready for that. Before I left, they gave me a 247 WhatsApp number for my coordinator.
Well, that's fantastic.
Yeah, they told me, if you feel a weird pain or just feel anxious, snap a picture and text us. That digital tether made all the difference.
It's all about having that communication.
Yeah.
So, looking back at all of this, the border, the tech, the biology, the mashed potatoes, what should patients ask before booking?
I wish I had known earlier exactly what to ask about the quote.
Meaning the hidden fees?
Yeah. The headline price sounds great, but does it include the facility fee, the IV sedation? If they find out you need a massive sinus lift mid-surgery, how much does the bone graft cost per gram?
That is so true. You have to ask for a worst-case scenario financial map.
Exactly, so you don't wake up owing $3,000 you don't have.
And let me add a few clinical questions to that list, because PlacidWay emphasizes this heavily. First, verify the dentist's credentials.
Right, don't just trust a fancy waiting room.
Ask if the doctor is an international member of the American Dental Association. Are they board certified in implantology? Demand to see their resume.
And don't feel bad about it. The good ones are proud to show you.
Absolutely. Second, ask about sterilization. You must explicitly ask if they use Class B autoclaves.
What makes Class B different?
Uses a vacuum pump to force steam into every microscopic crevice of the tools. It kills everything. If they get annoyed by that question, walk away.
Massive red flag.
And third, ask about the implant brands. Cheap clinics use generic knockoffs. High-end ones use premium brands like Straumann or Nobel Biocare.
They actually gave me an implant passport with the exact lot numbers of the screws in my jaw.
Yes, because if you need an adjustment back home in 5 years, your local dentist needs to know exactly what proprietary tools to use.
That makes total sense. And, I realized follow-up matters more than people think.
In terms of warranties.
Yeah. If a crown chips a year later or an implant fails, who pays for it? Do they cover the revision surgery? Get that in writing before they ever touch your mouth.
That is incredible advice. So to kind of wrap this up, speaking directly to the person listening right now who's looking at their failing teeth and they're just paralyzed by the fear of the unknown, what would you tell someone who is nervous about going?
I would tell you that the fear is completely normal. I mean, crossing a border for surgery is a big deal.
It really is.
But you don't have to navigate it blindly. Pay attention to how the clinic makes you feel during those first phone calls. For me, feeling heard by the clinic made a big difference.
Feeling heard, not just sold to.
Exactly. If they dodge your questions about sterilization or rush you for a deposit, hang up. But when you find a team that patiently answers your 3-page list of questions and treats you like a partner, the anxiety just melts away.
You replace the fear with education.
Yes. You become an empowered consumer, not a victim of insane U.S. prices.
And that transition to empowerment is exactly where PlacidWay comes in. Because vetting hundreds of clinics on Google is exhausting.
It's impossible to know what reviews are real.
Exactly. PlacidWay acts as a filtered lens. It lets you explore thoroughly vetted providers in Los Algodones. You can review the exact credentials of the dentists, read verified patient experiences, and use a secure platform to ask those complex medical questions.
And send your x-rays safely.
Right. And you can request a free, fully itemized quote so there are no hidden fees. It basically acts as your advocate before you ever pack a bag.
It definitely takes the guesswork out and the scariest part.
It really does.
Well, before we sign off on this deep dive, I want to leave you with one final thought to ponder. We talked a lot about the incredible technology in Molar City today. The 3D CBCT scanners, the in-house labs, the CAD/CAM milling machines making same-day crowns.
It's like living in the future. It is. So with border towns adopting this hyper-efficient in-house 3D manufacturing model, cutting out months of waiting, could these localized hubs eventually become the standard model for all major dental care worldwide, rather than just an alternative for tourists?
Wow, that is an interesting thought.
Something to mull over. Keep doing your research, keep asking the hard questions, and remember that you have options. Until next time.